Think of a healthy human brain like a highly complex, perfectly timed machine. To work right, it relies on billions of microscopic pathways passing signals back and forth without a single interruption. But in the early stages of Alzheimer's disease, that smooth communication starts to experience interference. The brain naturally produces a sticky protein fragment called amyloid. Normally cleared away, sometimes they clump into messy tangles. Left unchecked, these tangles solidify into stubborn physical roadblocks known as plaques, jamming the delicate gears of our mental machinery. For years, doctors faced a serious mechanical problem. How do we break down and clear out this hardened debris without accidentally damaging the fragile pathways around it? To meaningfully slow the progression of Alzheimer's, we have to go straight to the source and physically remove those deeply embedded structural blocks. This is where a medication called Kisunla, or Donanemab, comes in. It's a treatment given as an IV infusion every month for early, symptomatic patients. Interestingly, the medicine itself doesn't act like a broom sweeping away the debris. Instead, it works like a highly specific tagging system. The medicine searches the brain for hardened plaque blocks, ignoring healthy tissue to attach only to stubborn debris. This chemical tag signals the immune system to step in. The natural cleanup crew arrives, disassembles the blocks, and sweeps the space clear. By systematically pointing out exactly what needs to be removed, the treatment harnesses the body's native defenses to protect the remaining neural pathways from further damage. This chart compares how patients fared over 76 weeks. When researchers compared the treated patients to the group that didn't receive the actual medication, the data showed the treatment slowed clinical cognitive decline by roughly 35%. It is important to be clear about what that number means. Slowing the decline is not a cure, and this treatment cannot reverse memory loss that has already happened. Alzheimer's is a complex condition with many contributing factors. Clearing the amyloid plaques removes one major source of damage, which buys the patient more quality time, but it is only one part of the total effort required to protect the brain. We also have to consider the physical toll. When you aggressively clear deeply embedded debris out of an organ as sensitive as the brain, the process can cause some temporary irritation. The main side effect is a condition called ARIA. In plain terms, it means the brain experiences temporary swelling or very small microbleeds while it handles the intense cleanup process. Because of this swelling risk, doctors require patients to undergo strict, regular MRI scans to monitor the brain, especially during the first few months of the infusions. While the therapy offers a significant delay in how the disease progresses, taking it requires a serious commitment to clinical monitoring to ensure the cleanup happens safely. Many treatments for long-term diseases require patients to take medication indefinitely, scheduling their lives around hospital visits for years on end. Kisunla takes a very different approach. It utilizes a treat-to-clear model, meaning the therapy actually has a definitive finish line. Throughout the treatment schedule, doctors use specialized brain scans to track exactly how much hardened plaque is left in the patient's system. Once those scans confirm the debris has been successfully cleared out, the monthly IV treatments stop entirely. In clinical trials, roughly half of all patients reached this clearance milestone and finished their treatment regimen within just 1 year. This model reduces the long-term stress of constant hospital visits, giving patients more time to focus on their lives. If you or a loved one are experiencing early symptoms, speak with a neurologist about specialized blood tests or scans that look for signs of the disease to see if this treatment is a fit.